What happens to your kidney after a radical nephrectomy? Have you ever wondered what happens to your kidney after a radical nephrectomy? This surgery involves removing an entire kidney, usually due to kidney cancer. Let's explore the changes that occur in kidney function and overall health after this procedure. First, when a kidney is removed, the total kidney function decreases. This leads to an immediate reduction in the glomerular filtration rate, which is a key measure of how well your kidneys are working. It is common for patients to experience postoperative acute kidney injury shortly after surgery, affecting about 40 to 44% of individuals. This reflects a temporary decline in kidney function. However, the remaining kidney is quite remarkable. It undergoes adaptive changes to compensate for the loss. This process is known as hyperfunction, where the single kidney increases its filtration capacity. Within a week after surgery, the effective renal plasma flow in the remaining kidney can increase by about 30%. This compensatory function can last for many years, helping to partially restore kidney function, although it does not fully replace what was lost. In the long term, most patients see a gradual decline in kidney function during the first 3 months after surgery. After this period, kidney function tends to stabilize. Approximately half of patients recover their preoperative estimated glomerular filtration rate within 2 years of the surgery. However, some individuals may develop chronic kidney disease, especially if they had pre-existing risk factors like hypertension, diabetes, or obesity. If chronic kidney disease does not develop within 5 years after surgery, it is unlikely to occur later, indicating that kidney function stabilizes for many. It is important to note that patients with severe chronic kidney disease before the surgery have a higher risk of progressing to end-stage kidney disease afterward. Interestingly, studies show no significant difference in the long-term risk of end-stage kidney disease between radical nephrectomy and partial nephrectomy in these patients. Factors such as younger age, being female, and having a lower preoperative estimated glomerular filtration rate are linked to better recovery of kidney function. Monitoring kidney function is crucial, especially in the first 3 months after surgery. This helps detect acute kidney injury and assess recovery. Long-term follow-up is also recommended to watch for the development of chronic kidney disease. Maintaining overall kidney health is essential. This includes managing blood pressure, controlling diabetes, and adopting healthy lifestyle choices to support the remaining kidney's function. In summary, after a radical nephrectomy, the body relies on the remaining kidney to compensate for the lost function. While there is an initial decline in kidney function, many patients experience partial recovery over time. However, there is an increased risk of chronic kidney disease, particularly in those with other health issues. Careful monitoring and management are vital to preserving kidney health after this treatment for kidney cancer. Always consult with healthcare professionals for personalized medical advice.